All right, let's dive into one of the biggest shifts happening in medicine today: artificial intelligence in the operating room. We're going to look at how AI is already changing things right now, and then we'll look ahead to where this is all going, from helping out to actually becoming autonomous. But first, we have to do this: a quick but really important disclaimer. Everything we're talking about today is for reference and informational purposes. Please, always follow your local guidelines and institutional protocols in your own clinical practice. Okay, with that out of the way, let's get right to it. We're going to tackle the one question that really matters for anyone in this field. How is AI going to fundamentally change the way you operate? To really understand the future, we have to get our feet planted firmly in the present. And right now, in 2025, we are deep in the era of the augmented surgeon. The key word there is augmented. AI is an assistant, not a replacement. AI's impact isn't just some isolated thing that happens in the OR. It's actually woven through the entire surgical journey. You can really see it in three key phases: before, during, and of course after the procedure. So even before a single incision is made, things are getting incredibly personalized. AI algorithms are chewing through CT and MRI scans, automatically mapping out organs and highlighting tumors. This creates a detailed 3D surgical roadmap that's unique to every single patient. On top of that, it's analyzing health records to predict risk, which lets you target prehab to get patients into the best possible shape before they even hit the table. Now, inside the OR, this is where things get really dynamic. AI has become what you could call a context-aware partner. It's watching the live video feed, understanding what's happening, and giving you real-time cognitive help. Think of it like a co-pilot who has a perfect encyclopedic memory of anatomy. So what does that actually look like? Well, for example, the system can literally highlight critical structures, say the ureter during a colectomy, to help you avoid injuring it. It can look at tissue and assess perfusion to tell you if an anastomosis is likely to hold. And yeah, we're even seeing it take over semi-autonomous tasks like suctioning and suturing, which, cuts down on fatigue and can shorten operative time. And the AI's job isn't over when the patient leaves the OR, not by a long shot. After surgery, it becomes this incredibly vigilant monitor. It generates early warning scores that can predict something like sepsis hours before it would normally be obvious. This means you can intervene earlier, and it's also the engine behind new models of care, like remote patient monitoring and the whole hospital-at-home concept. So that's what's happening today. It's already pretty incredible. But all of this augmentation, it's really just the foundation for what's coming next. We're talking about a transition from a helpful assistant to a truly collaborative, autonomous partner. And this isn't just some vague future prediction. There's a pretty clear timeline emerging. Right now, we're in that assistive augmentation phase. But by around 2028, we fully expect to see regulatory approval for limited task autonomy. Fast forward to 2035, and the goal is to have all these separate tools pulled together into single holistic surgical platforms. Okay, now it is so important to be clear about what we mean by autonomy. This does not mean a robot is going to be performing an entire Whipple procedure by itself. Not at all. What it means is the system will be able to execute very specific, defined tasks, like performing a perfect anastomosis with superhuman precision, but always under the direct supervision of the surgeon. The real paradigm shift, the true game changer, is going to be the integration of all these separate AI tools into one seamless thing: a surgical intelligence platform. These platforms will create and maintain a continuous digital twin of the patient, managing their data and guiding their care from the very first scan all the way through to full recovery. This technological leap is just breathtaking, but it also forces us to ask some really profound and, frankly, difficult new questions. So for our final section, let's turn to the critical ethical issues and what this all means for the evolving role of the surgeon. And here it is. This is the big one, the question everyone is trying to figure out. When an autonomous system makes a mistake, who's responsible? Is it the surgeon who is supervising, the hospital that bought and installed the system, or is it the company that wrote the code? Well, the most likely answer is going to be a totally new legal framework based on shared responsibility. The surgeon is still the captain of the ship, the supervisor, the final decision maker. The hospital is on the hook for proper implementation and oversight. And the tech company, they're responsible for making sure their algorithms are validated and their hardware is safe. The burden of liability won't be on one person anymore. So what does this all mean for you, for the surgeon? It's a massive shift. In the past, the job was so heavily focused on manual dexterity, on pure technical skill. In the future, that focus is going to evolve. It'll be more about masterful oversight, about interpreting incredibly complex data from these AI systems, and maybe this is the most important part, doubling down on the human connection with the patient. Because you see, in the end, this isn't about human versus machine. It was never about that. The ultimate goal, the whole vision, is to create a synergy, AI-powered surgeons achieving results that are way better than what any human or any machine could ever do on their own. This transformation, it's not some distant, far-off future. It is happening right now. The technology is evolving, and that means the profession itself has to evolve right along with it. So the final question is really for you to think about. Your evolution as a surgeon is here. The question is, are you ready?